Hi, everyone, and welcome back to the Deep Dive. Today we're tackling something pretty significant, cancer phobia.
That's right, also known as carcinophobia.
And we're going to explore what this actually is, this anxiety disorder.
Yeah, it's defined by this really chronic, quite powerful fear about developing cancer. It's not just, a passing thought.
It's persistent.
Very persistent, a state of real apprehension.
And it's clearly something that needs more understanding. Our sources really point out this isn't minor. We're talking deep sadness, real fear.
Panic sometimes, yeah. And just ongoing distress.
Exactly. And in really extreme cases, this fear can just dominate. It can stop someone living a normal life, basically. So our aim today is, well, to get a better handle on what cancer phobia really means, maybe who's more susceptible.
And crucially, what can actually be done about it. We're drawing on some solid psychological resources for this.
Great. So let's start with the definition then. What is cancer phobia at its core?
Okay, so like we said, fundamentally, it's that chronic, really overwhelming fear of getting cancer.
And it's officially recognized.
Oh, yes. It's classified as a specific phobia, falling under that wider umbrella of anxiety disorders.
Right. So it's definitely distinct from just, general health worries that most people probably have now and then.
Absolutely. The intensity is key here. The materials we looked at emphasize the sheer strength of these feelings. Genuine sadness, fear that can be quite paralyzing, constant distress.
And it's that level of intensity that really disrupts things. Like someone might get a cough, maybe.
And immediately think lung cancer, even with no other real reason. And that thought it consumes them.
Wow. Yeah.
And the impact, well, it can be really profound. Our sources show a strong link between this phobia and depression.
That makes sense. How does that often manifest?
Well, people might start to pull back from social life, become quite isolated, really. Their world kind of shrinks down to just focusing on these health anxieties.
So they become hyper-vigilant about their bodies, always on the lookout.
Exactly. Constantly checking, worrying about every little ache or pain. The sources talk about feeling completely overwhelmed by it all.
To the point where just doing normal daily stuff becomes hard.
Yeah, potentially. It stops being about sensible health awareness and becomes this all-consuming anxiety running their life.
And this must affect how they view the future, too.
Definitely. There's mention in our research about a reluctance to even make plans. Why plan for next year if you're convinced you'll have cancer by then?
Gosh, that sounds incredibly limiting.
It is, and as one source points out, it leads to a significantly poorer overall quality of life.
Now, this is really interesting. The why behind it. Our sources suggest it's tied into how we perceive cancer, right?
Yes, a lot of it seems to stem from that perceived unpredictability, that feeling it could strike anyone, anytime, seemingly at random.
And maybe the idea of it being hard to beat, that indestructibility idea.
Exactly. We hear so many stories of long, difficult battles. Even with recovery, there's often that fear lingering. Combine that with, well, the fundamental fear of death.
It creates a perfect storm for anxiety.
It really does. A very pertinent trigger.
And it's not just people who've never had cancer who experience this, is it?
No, absolutely not. And this is a critical point. Cancer survivors themselves are actually at significant risk.
Of fearing it'll come back.
Precisely. The fear of recurrence. The data we looked at suggests about half of all cancer survivors report a moderate to high level of fear about their cancer returning.
Wow, half. That's huge. You might almost expect relief after treatment, but instead...
For many, it seems to plant this seed of ongoing anxiety. It's understandable, given what they've been through.
Yeah, they know exactly what it involves. And do these sources link cancer phobia to other conditions too?
They do, yes. There's often an overlap with hypochondria, that more general, persistent worry about having serious illnesses.
Okay.
And also connections to PTSD, post-traumatic stress disorder.
How does that fit in?
Well, imagine someone who witnessed a loved one go through a very traumatic cancer experience. That trauma could, unfortunately, lead to PTSD, which might then
Get tangled up with other issues.
very much so.
And the key takeaway seems to be, well, anyone could potentially develop this phobia.
That's right. There isn't one specific type of person,
No.
but certain experiences definitely seem to increase the risk.
Things like,
Things carrying a lot of emotional weight, like having had cancer yourself, obviously.
or seeing someone close go through it.
Yes. Witnessing a loved one develop cancer, or sadly experiencing the death of someone close from cancer. These are incredibly impactful life events.
And they can leave this lasting fear.
They certainly can. It really underlines the huge emotional shadow cancer casts.
Okay, so we've got a sense of the what and the who. Let's just briefly revisit the why. It boils down to unpredictability and mortality.
Pretty much. That fundamental uncertainty around serious illness, feeling out of control, combined with our basic fear of dying, those seem to be the core drivers.
Right. So the big question then, what can actually help someone struggling with this? What treatments or management strategies are out there?
Well, the good news is there are effective strategies. Psychotherapy is definitely recommended.
Like talk therapy.
Yes, and specifically, cognitive behavioral therapy, CBT, comes up frequently as being particularly effective for managing anxiety, including in cancer patients, and by extension, for cancer phobia.
Okay, CDT. Can you unpack that a little? How does it work in this context?
Sure, so CBT essentially helps people become more aware of their own thought patterns, especially the ones linked to the fear.
The negative spirals.
Exactly. It teaches you techniques to sort of catch those anxious thoughts, question them, and develop healthier ways to cope with the emotions they trigger.
So challenging those automatic worst-case scenario thoughts, like the cough example earlier.
Precisely that. It helps you examine the actual evidence, look for other, maybe more likely explanations, and just bring more balanced perspective. It's about understanding the phobia and learning real skills to manage it.
That sounds very practical
Yeah.
and empowering, potentially.
It can be, yes.
And the resources also mentioned mind-body techniques. What are those about?
Right. These are techniques aimed at reducing anxiety by focusing on that connection between your mind and your physical body. They help manage fears, including this one.
By calming the physical stress response.
Essentially, yes,
Yeah.
promoting relaxation, lowering those physiological stress levels.
What kind of specific techniques are we talking about?
Well, the sources mention things like progressive muscle relaxation.
That's one where you tense and then relax different muscles.
That's it. It helps release physical tension. Then there's guided imagery using calming mental pictures.
Visualizing a peaceful place, maybe?
Exactly. Shifting focus away from the fear. And also diaphragmatic breathing or deep breathing.
Just simple deep breaths.
Focused, deep breaths from the diaphragm. It directly helps calm the nervous system's stress response. Really effective.
Those all sound like things people could learn fairly easily.
They are quite accessible, yes.
And meditation techniques were mentioned too.
Things like journaling can be helpful, just getting those anxieties out onto paper.
Processing them.
Right. And also meditative movements, things like yoga, tai chi, even mindful dance. They combine physical movement with that mental focus.
And does the research show these things actually work for this kind of anxiety?
Yes, the research suggests that these relaxation skills and meditation practices can have a real impact. Maybe small for some, more significant for others, but definitely beneficial in managing cancer-related anxiety.
So it's encouraging then. There's a range of tools, from therapy like CBT to these mind-body practices.
Absolutely. There are evidence-based approaches that can genuinely help people cope better and improve their quality of life. It's so important people know help is available.
Definitely. They don't have to just live with that level of fear.
Not at all. These strategies can help regain a sense of control.
Okay, so let's try and pull this all together. We've taken this deep dive into cancer phobia, or carcinophobia. We've defined it as that chronic, often debilitating fear of getting cancer.
We explored the impact, the sadness, the isolation, how it can really reduce quality of life.
Yeah, and we looked at who might be more susceptible survivors, yes, but also those who've seen loved ones affected, driven by those deep fears about unpredictability and, well, death.
But crucially, we also looked at the help available, effective help like CBT.
Cognitive behavioral therapy, and those various mind-body techniques like relaxation, breathing, meditation.
Exactly. And the main point really is, while some concern about cancer is normal, maybe even healthy, when it becomes this constant, overwhelming fear that stops you living your life.
Then it's become a serious anxiety disorder.
Right. And it needs attention, understanding, and the right kind of support.
Absolutely. So perhaps a final thought for you, our listener, to maybe mull over. Given everything we've talked about regarding the individual experience and the anxieties driving cancer phobia, what broader factors in society might be contributing to how common this is?
That's a good question.
You know, things like how cancer is portrayed in the media, maybe, or cultural attitudes towards illness and death. How could understanding those wider influences help us create better support systems or even preventative approaches down the line?
Yeah, thinking about the bigger picture.
It's clearly a complex issue, isn't it, with layers stretching beyond just the individual person. Something to think about.